Hi everybody, Dr. Kristy Lamb here with Bold Health. I wanted to reach out and provide another guided breathwork exercise for today in the midst of increased anxieties. One of the main things that we can do is really work to get clear about that which we have control over. There's a lot right now that we don't have control over, and so being able to bring our focus to our breath in the midst of the thoughts, the worried thoughts that are coming up, can we come back to our bodies, regulate our anxiety through breath work so that we can feel more calm and comfortable in our bodies regardless of what is going on in the external world right now, which I think there's a lot that has got our baseline levels of anxiety increased. So today we're going to do what's called belly breathing. We talked before, I have a video up about butterfly breaths where we can notice our lungs rise and fall. We know that oxygen and prolonged inhales and exhales can really help with regulating anxiety. And so today we're going to extend that inhale more than just kind of feeling the lungs rise and fall. We're going to bring it into the belly. So no, the oxygen does not actually go into the belly. And when we're talking about it, it's actually not our belly because our stomachs are actually a little bit higher up. But we call it belly breathing because we're going to notice the abdomen, right, rise and fall in the midst of our breath so that we can notice our bodies, focus on pulling in all that oxygen, that nourishing and calming oxygen that can help regulate our anxiety, and then the full prolonged exhale that really activates the autonomic nervous system to help calm things down. So we'll start as we always do in a seated position, feet flat on the ground. Allow yourself to kind of get comfortable in your seat, ground into your sits bones, chest nice and open, and I like to sit initially with my hands open on my lap, receptive and just settling into my body and just starting to notice the natural rhythm of my breath. So as all the thoughts come through, we'll just return back to our breath and start to notice the natural rhythm, the inhale and the exhale. Thoughts may come. It's not a problem, right? This is the nature of the mind to bring up thoughts that we can then label, like planning, worrying, thinking. We can let those thoughts just pass through and we can bring our focus back to the breath. So for this breath work, as we're just allowing that natural breath to do its thing, as we start to settle into our bodies, we're going to bring our hands clasped over our bellies. I'm going to pull back so you can see this here. Right? And we'll notice that often, I was doing this with my daughter, and when she thinks about taking a nice deep breath, she thinks of pulling in to take the deep breath. But we're actually going to use the mantra soft belly, because if we think about it, when the air comes in, we're going to be expanding into our bodies with the inhale, and the exhale releases, and that's where the contraction actually comes in. So the words that I'll use are going to be inhaling on soft and exhaling on belly. We're going to do this to a 5 count, normalizing and regulating the inhale and the exhale. And we want to keep our focus down at the abdomen and allow our hands, right, to expand as we bring the oxygen in and to release as we let the oxygen out. The reminder is soft belly, to keep the abdomen nice and soft, to let it just expand out naturally, right? For many of us, we may have the impulse to suck in the gut, that kind of thing. We're going to just let the body do what it does naturally with the breath to bring in that calming, relaxing ebb and flow that comes with our natural rhythm of breath, and we'll just extend that out, right? So we're going to be doing 5 counts in, 5 counts out, inhaling and exhaling, inhaling soft, letting the belly expand, exhaling belly, letting the belly drop down to its natural position. So as always, we'll start with a nice exhale, letting out any stale air. Then we'll inhale for 5, soft. Exhale, belly. Inhale, 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 soft. Exhale, belly. We'll go for one more minute. Inhale, soft. Exhale, belly. 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 Allow your breath to come back to its natural rhythm. Wiggle your fingers and toes. Let yourself come back into your body. Give yourself just a moment, as with at the end of any breath work or meditation, just to notice any shifts. I know for me, I can start to feel a little bit more in my body, right? I can feel actually a little bit more tension in certain areas where I had been maybe ignoring myself. And so I can just attune to those areas and try and relax just a little bit, right? Let all of this settle in. A reminder that it's completely normal to feel a little bit lightheaded after any breath work as we're building the capacity to prolong that inhale and the exhale. Thank you so much for joining. I hope that this was helpful. I'll work on continuing to provide more resources. And again, if there's anything specific that you want me to talk about or exercises that you're looking for, let me know. I'm happy to support your individual needs. Feel free to leave a comment or to direct message me on Instagram or through Kristy Lamb MD or Bold Health Inc. Please know that we're here, we are open, we are accepting patients, and we're here to provide resources for you during this time. We will get through this together, and thanks so much for checking out the website.